In this video, we'll be talking about the question muscles and fascias of the back. First, we'll be talking about the muscles of your back. You can divide them into three layers: superficial, intermediate, and deep muscles of the back. In the superficial layer of your back muscles, you have two groups of muscles according to their origin and insertion. Your first group is the spinohumeral muscles, which is the trapezius and the latissimus dorsi. So they originate from somewhere in the spine and they insert into somewhere in the humerus or near the humerus, right? First muscle, trapezius. They will originate from your nuchal ligament, skull, and spinous processes of your C7 to T12 vertebrae, and they insert into your clavicle, acromion, and the spine of your scapula. Now there's three fibers here in the trapezius. You have the descending fibers, the transverse fibers, and the ascending fibers, right? Now, the functions are also according to the direction of the fibers. When the descending fibers, or the first part, upper fibers, contract, they will elevate your scapula. When your transverse fibers contract, they retract your scapula. And when your lower fibers contract, they pull your scapula inferiorly. This is the major function of your trapezius. And this muscle is innervated by your accessory nerve. The second muscle that we'll talk about here is your latissimus dorsi. Your latissimus dorsi, again, spinohumerus. So from your spine, the spinous processes of T7 to T12, iliac crust, and your thoracolumbar fascia. They originate from all these points and they insert into the intertubercular sulcus of your humerus. The nerve that innervates your latissimus dorsi is your thoracodorsal nerve, and the function of this particular muscle is to extend, adduct, and medially rotate your upper limb, your arm. Now, we have the second group of muscles, which is your spino-scapular, SS, spino-scapular muscles. So all of these three muscles, they basically originate from your spine and they insert into your scapula. The first muscle, levator scapulae, they originate from your transverse processes of C1 to C4 vertebrae, and they insert into your medial border of your scapula in the superior part, right? And the function is, again, it's given in the name itself. It's to elevate your scapula. The second muscle is rhomboid minor. It also originates from the spine and it inserts into the medial border of your scapula. Then you have your rhomboid major, which also originates from your spine and it inserts into the medial border of your scapula and a little bit in the inferior angle of your scapula. These two muscles, when they contract, they retract and rotate your scapula. Now, all the spino-scapular muscles, they're all innervated by your dorsal scapular nerve, right? So this is about your superficial layer of your back muscles, superficial back muscles, right? Now we'll be talking about the intermediate back muscles, in which there are two muscles, serratus posterior superior and serratus posterior inferior. Now, these are called spinocostal muscles, that is SC. So they originate from your spine and they insert into your costal areas, which is your ribs, right? So the superior muscle, serratus posterior superior, it originates from your nuchal ligament. You can see the purple muscle in this diagram, and your spinous processes of T7 to C7 to T3, sorry, C7 to T3. So your cervical 7 to T3, and they insert into your ribs 2 to 5, the upper ribs, right? And when these contract, it basically elevates your upper ribs. Now, your serratus posterior inferior muscles, they originate from your spinous processes T11 to L3, way below, right? And they insert into your ribs 9 to 12. So when these contract, they basically depress your ribs 9 to 12. These two muscles are innervated by the intercostal nerves. The next layer of muscles that we are going to talk about is the deepest layer of your back muscle. And the deep back muscles itself, you can divide them into three layers. Superficial layer of your deep back muscles, intermediate layer of your deep back muscles, and the deep layer of your deep back muscles. Now, the muscle that I'll be talking about here is your intermediate layer. You have three sets of muscles here, which is iliocostalis, longissimus, and spinalis. These three muscles are all together called the erector spinae muscles, and they um they are in this particular order, like from lateral to medial, it is ILS, right? You can see the diagrams here, longissimus, iliocostalis, and your spinalis muscles, spinalis muscles. Okay, all of these, they originate from your spine and also insert into your spine itself, but they're all innervated by the posterior branch of your spinal nerves, and it depends upon the area it is present in for it to be whether it's from the cervical, thoracic, or lumbar spinal nerves, right? And yeah, iliocostalis basically has a lumborum part, thoracic part, and a cervical part. The longissimus muscle has the thoracic part, cervical part, and the capitis part. And your spinalis muscle has thoracic part, cervical part, and your capitis part. Now, all these muscles, again, what is their function? Their function is to basically extend your vertebral column and the head. When either sides of your vertebral column, the muscle fibers on both the sides contract, they basically extend your vertebral column of the head. The word you use here is bilateral contraction. If it's unilateral contraction, that is only one particular side of your muscles are contracting, they cause lateral flexion of your vertebral column. Now we'll be talking about two other layers, as I said, the superficial and the deep layer of your deep back muscles. First, the superficial layer of your deep back muscles, they're called spinotransverse system because uh, they basically originate from the spinous processes of your vertebra and they insert into the transverse processes of your vertebra. So there's two muscles here, splenius capitis and splenius cervicis. And the major function of this is to extend and rotate your head and neck. And the innervation is basically your posterior rama of C3, C4, or like basically lower cervical spinal nerves, right? Now, we'll go to the deep layer of your deep back muscles. There's basically three muscles, rotators, which are short and long rotators, multifidus, and semispinalis. Right? You can see the picture here. So first, we'll talk about semispinalis. They these are called transverse spinal system. Why? Because they go from your transverse processes to your spinous processes of your vertebral column, right? This semispinalis muscle, it is innervated by your greater occipital nerve, which has a root. It basically extends and contralaterally rotates the head and vertebral column. Contralaterally meaning if I contract the right side of a muscle, I move or rotate towards the left side. That is, contraction of the muscle in one side causes the rotation towards the opposite side, which is called contralateral rotation. Next is your multifidus muscle. The multifidus muscle, again, it's a transversal spinal system. So from transverse processes to spinal processes. Uh, this muscle is basically responsible to stabilize your vertebral column. Then you have your rotators. The names itself suggest the function of these muscles. If it's a unilateral contraction present, then they cause contralateral rotation. That is, if I contract my left short or long rotators, I will rotate my head towards the right, or yeah, towards the right. So it's the contralateral rotation. And when both my sides are contracted, when I bilaterally contract these muscles, it causes the extension of my vertebral column. Now, the multifidus and rotators, they're both innervated by your posterior branch of your spinal cord, spinal nerves. And again, it depends on the location, whether they're cervical or like which segments of the spinal nerves, spinal column do the uh, nerves innervate these muscles, right? So yeah, that's it for the muscles. Now fascia, it's majorly thoracolumbar fascia for the back. And thoracolumbar fascia itself has like three layers. It has the anterior portion, middle portion, and the posterior portion, and these divide the muscles. Okay, so you have your quadratus femoris in between the anterior and middle portion, and your deep back muscles are present between the middle and your posterior portion of your thoracolumbar fascia. So that's it for this particular question. Thank you.